my name is Charlie Cotner, and I will be discussing different types of shock. The definition of shock is a life-threatening condition that occurs when the body is not getting enough blood flow. There are 4 types of shock: cardiogenic shock, distributive shock, septic shock, and obstructive shock. The first one that we will be discussing is cardiogenic shock. With cardiogenic shock, you will see a decrease in cardiac output, increased tissue hypoxia, but you will see an adequate intravascular volume. Heart dysfunction equals inadequate cardiac output. Cardiogenic shock is also known as pump failure shock. And basically this means that some type of heart dysfunction is not allowing the heart to maintain an adequate cardiac output. Patient assessment will include hypotension, absence of hypovolemia, signs of poor tissue perfusion such as cyanosis or cold hands, feet, and an altered mental status. Peripheral pulses are fast but faint and may be irregular due to arrhythmias. You will see jugular venous distension, crackles upon auscultation of the chest, peripheral edema, distant heart sounds, tachycardia, and decreased urine output. Many of these symptoms go hand in hand with decreased cardiac output, and early diagnosis of cardiogenic shock is key. Other diagnostic tools include lab workups like CBCs, cardiac enzymes, ADGs, and lactates. An ADG will show oxygenation of the blood, which will presumably be low due to the poor cardiac output and perfusion. Additionally, echocardiograms, chest x-rays, and angiograms can aid in diagnosing this type of shock. An ECG waveform can also help to diagnose. Most commonly, you will see an ST segment that is elevated and that is present in a myocardial infarction, or an ST depression, which is seen in acute coronary syndrome. Hemodynamic monitoring is essential. You would want to insert a Swan-Ganz catheter, which can determine what type of shock you are dealing with. In cardiogenic shock, the measured PCWP will be greater than 15 torr, and the cardiac index will be less than 2.2 liters per minute, again due to the decreased cardiac output. Large V waves on the PCWP suggest anomalies with the mitral valve and an increase in oxygen saturation between the right atrium and the right ventricle suggests a ventricle septal rupture. Another indication of cardiogenic shock is an increased right-sided filling pressure in the absence of an elevated PCWP, indicates right ventricular infarction. Again, the common theme here is that the patient is having heart issues. The next question is, how do we treat cardiogenic shock with medications and different types of drugs? Inotropic agents like dopamine and dobutamine will help restore that low blood flow during cardiogenic shock and increase the heart contractility. So increased blood flow, increasing the muscle and its ability to pump throughout the heart will hopefully help your perfusion and the circulation of that blood throughout the body. After all, the greater the contractility, the more cardiac output you will get. Nitroglycerin IV is also given as a vasodilator to relax the vascular smooth muscles to help decrease preload and afterload. And aspirin is given to prevent blood clotting issue and reduces the risk of thrombosis and stroke. An analgesic such as morphine sulfate may be given to reduce pain, which will also reduce stress on the body and reduce preload to the heart. Loop diuretics are also given to reduce plasma volume and peripheral edema just until the normal levels are obtained, since diuretics can also reduce cardiac output and blood pressure. Most cardiogenic patients will require intubation and mechanical ventilation with high flow oxygen. However, as with any other positive pressure ventilation, it can negatively impact your venous return. Non-invasive positive pressure ventilation is a good alternative to improve oxygenation in those with cardiogenic pulmonary edema. So CPAP, BiPAP. Appropriate settings are vital to obtain and maintain normal ABG results, as acidosis can also have a negative effect on myocardial infarction. And that's all on our cardiogenic shock. Thank you.